Hey guys, how's it going? Thank you for taking the time to watch this short video on this Funly page about my quest to ultimately limit the number of non-contact injuries and concussions in today's youth. So, a little bit about concussions first off, and some numbers just to kind of wrap your brain around. In the U.S., about 30 million children and teens participate in some form of organized sports. And of those 30 million children or teens, more than 3.5 million injuries each year occur, which cause some loss of time and participation and their experience by these participants in the sports, right? So almost 1/3 of all injuries incurred in childhood are sports-related injuries, which is crazy. That's a crazy number to understand. And by far the most common injuries are sprains and strains. Now, obviously, some sports are more dangerous than others. For example, contact sports such as football can be expected to result in a higher number of injuries than a non-contact sport such as swimming. However, all types of sports have a potential for injury, whether from the trauma of contact with other players or from overuse or misuse of a body part. Right? The following statistics are from the National Safe Kids campaign in the American Academy of Pediatrics. Approximately 3.5 million children and adolescents ages 14 and younger get hurt annually playing sports or participating in recreational activities. Although death from a sports injury is rare, the leading cause of death from a sports-related injury is a brain injury, i.e. concussions. Sports and recreational activities contribute to approximately 21% of all traumatic brain injuries among American children and adolescents. The majority of head injuries sustained in sports or recreational activities occurred during bicycling, skateboarding, or skating incidents, or sports such as football, lacrosse, and wrestling. More than 775,000 children and adolescents ages 14 and younger are treated in hospital emergency rooms for sports-related injuries each year. Most of these injuries, though, occurred as a result of falls, being struck by an object, collisions, and overexertion during unorganized or informal sports activities. Now, where and when do these happen? Playgrounds, sports, bicycle-related injuries. They often occur most with young children between the ages of 5 and 14 years old. Bicycle and sports-related injuries also affect older children and adolescents in addition to overexertion, which is overuse of the body and not knowing where the body is breaking down. The highest rate of injury occurs in sports that involve contact and collisions. Again, lacrosse, football, wrestling, all right? Most severe injuries occur during individual sports and recreational activities. And most organized sports-related injuries, 62%, occur during practice. So who does this affect? More than 30 million high school children participate in organized sports. Children between 5 and 14 years of age account for almost half, which is 40%, of sports-related injuries for all groups, and more than 775,000 children participating in sports activities are injured each year, and 1 in 4 injuries is considered serious. So, children who are less developed than a more mature child of the same age and weight are at increased risk for injury, which is very alarming. All right, sports-related injuries. The severity of sports-related injuries increase with age as kids get older, right? Before puberty, girls suffer more sports injuries than boys, right? And during puberty, boys suffer more injuries more severely than girls because their body is growing. Their bones are still very soft in terms of growing, and a lot of non-contact injuries, tendons aren't really developed completely yet. And children who are just beginning a sport or activity are at greater risk for injury, right? So the types of sports and recreational activities that we see, and consider these estimated injury statistics from 2009, and the cases have considerably risen since then. Basketball, more than 170,000 children ages 5 to 14 were treated in hospital emergency rooms for basketball-related injuries, knee injuries, ankle injuries, things like that, even trauma to the head, falling, hitting their head on the court. Baseball and softball, nearly 110,000 children ages 5 to 14 were treated in hospital emergency rooms for baseball-related injuries. Baseball also has the highest fatality rate among sports for children ages 5 to 14, with 3 to 4 children dying from baseball injuries each year, blows to the head, right? Collisions, things of that nature. Football, almost 215,000 children ages 5 to 14 were treated in hospital emergency rooms for football-related injuries, with nearly 10,000 of those hospitalized as a result of their injuries. Ice hockey, more than 20,000 children ages 5 to 14 were treated in hospital emergency rooms for ice hockey-related injuries. Soccer, about 88,000 children ages 5 to 14 were treated in hospital emergency rooms for soccer-related injuries. And then you have other just various minor things or activities that kids are doing on which they're constantly getting hurt. The most alarming statistic is concussions, right? And you're kind of asking yourself, how many sports concussions occur each year? Well, it's estimated that as many as 3.8 million concussions occur in the U.S. per year during competitive sports and recreational activity. However, as many as 50% of the concussions may go unreported. This is due to little testing for baseline concussions, right? And then retesting when an athlete gets injured, rather just going on the human eye. And this is something that we're severely passionate about, and that we want to help athletes be better. So our goal here is to afford a system that is going to help athletes, all right, get a better baseline of their movements, right, and their baseline concussion testing using 3D motion capture technology, all right, that is going to give us a massive plot of data to help athletes either A, right, decrease the risk of these injuries, or B, understand the injuries if they happen and get back and return to play safely with more advanced testing measures. And that is our ultimate goal. If we can help at least one kid, right, each year get back to playing their sport safely and in an effective manner, we have done our job. But I feel as if it doesn't stop there, and this type of program that we're looking to put together and fund is going to be crucial for helping youth athletes avoid non-contact injuries, ACL, right? Achilles tears, all right, things of those nature, as well as labrum tears, Tommy John, which are huge categories and huge surgeries that are happening, along with concussions. If we can help them, one athlete each year, avoid a catastrophic injury, then we have done a great job in starting to lower that threshold of injuries. So that is our goal here at Lights Out Academy. And our goal is, again, to decrease the number of non-contact injuries, as well as educate all these athletes on concussion testing and how they should develop a baseline and be reassessed if an injury is to happen. So we look forward to you watching this video, and I hope you found this informational. And hopefully within the coming months, we will get to our goal of creating and funding this technology to help all the youth athletes that we possibly can to help lower this statistic moving forward. Take care.